Good morning, good afternoon, good evening, depending where you are based. My name is Marta Lomazzi. I'm the Executive Manager of the World Federation of Public Health Association. It's my honor today to chair this webinar on value-based vaccination. What are the costs of non-vaccination? This webinar aims to present globally the results of the value-based vaccination project led by Vitali, a spin-off of the Catholic University of Sacred Heart in Italy. So without losing any time, I would like to introduce our first speaker, Professor Walter Ricciardi, the president of the World Federation of Public Health Association, as well as Professor of Hygiene and Public Health at the Catholic University of Sacred Heart in Italy. He is also advisor to the Minister of Health of Italy for the Corona pandemic, as well as president of the Mission Board for Cancer of the European Commission. Walter, the floor is yours.
Thank you very much. I tried to share the screen. I hope you see my first slide. The value-based approach for vaccination regards one of the most important technology. We know that vaccination is the most successful public health measures of modern times. We have the figures, billions of children and people protected around the world, currently preventing millions of deaths every year, saving lives all over the world. Nevertheless, although the value and the real and tangible benefits are recognized globally, there is a problem. Instead of an increase of a general decline in coverage rates that can be partly attributable to the vaccine hesitancy. The vaccine hesitancy represents a real threat to the health and well-being of citizens, determining significant effects on the effectiveness of immunization programs. So we have to understand, of course, why and how we can work on this. And in general, the world, in particular, the healthcare sector is undergoing a major transformation. Certainly, the digital transformation, the genomics revolution are playing an important role. But the most important transformation is going from low-value, bureaucracy-based care to high-value, personalized and population-based care. So we have to work, and we are working in this direction. And in the expert panel of the European Commission, which I was part up to last year, and Professor Siciliani is now here, we worked on the operationalization and guiding principle for making healthcare value-based in Europe. And we can do that in a specific way because in Europe, health is considered to be an intrinsic value, a precondition for pursuing a good life. And in Europe, we share the concept of universal health care intended to provide health to the population and equitable achievement for health. So we define the value-based health care, particularly focused on access and equity, on social justice and fairness, on quality and performance, on efficiency and productivity. And we also issued the principles for practical implementation. One is exactly what they are doing today, awareness, raising awareness on this. Then, of course, research and development, producing and creating learning communities. And again, is the work of this morning, accountability, encouragement of health professionals to take responsibility and to feel accountable for population health and engaging patients. Furthermore, the European Commission has engaged in the domain of preventions, in particular of cancer, in two very important activities. One is the Mission on Cancer, which I'm sharing, and the second is Europe's Speeding Cancer Plan. Concerning the mission's approach provides a solution, an opportunity, and an approach to address the numerous challenges that people face in their daily lives. And we have developed an approach under the mission, a plan that identifies 5 complementary areas: understanding, prevention, diagnosis and treatment, to supporting quality of life, and ensuring equitable access. And we have planned 13 bold actions, 13 bold recommendation related to the different area, 2 on research. And we believe that there is a great room for studying and understanding better the interaction between infectious agents and cancer. We believe that up to 40% of cancer can be justified by infections. And of course, prevention, in particular, some cancer that are already deemed etiologically related to infections, such as HPV. And in the European Beating Cancer Plan, which has been somehow guided by the work of the Mission Board for Cancer, there is a flagship dedicated to the elimination of cervical cancer and other cancer caused by human papillomavirus. And this action has been embraced by all stakeholders and, of course, also by the World Health Organization. As Dr. Tedros says, 1 woman dies of cervical cancer every 2 minutes in the world. Each one is a tragedy, in particular because we can prevent it. We know we can make it, and we have to do that. So the values of vaccination. So this is the project that we are describing today in the framework of the value-based approach expressed by the expert panel of the European Commission. So we have to understand that, of course, personal value guides our decisions. We can save life, we prevent disease, we can make children stay in school longer, we can lose fewer days of work, and of course we can make cost of health decreasing. But it's very important when you want to grant access, equitable access, it is essential to assess the cost of non-vaccination and implement policies that favor the practice of vaccination throughout the world, because the reallocation of resources from low to high value care is crucial. We will not have endless resources. So we have to allocate the resources in the best way. And we also have to understand that some inactions are very expensive and we have to avoid that. Of course, it's very important to understand the technical value because vaccines help realize the broad spectrum of benefit that add to health and to the economic and societal gains of immunization. So we have, of course, make all the kinds of evaluation, health technology assessment, new models of economic evaluation, data collections, analysis, digital health. In other words, evidence-based decision-making. And last but not least, the protections of others through herd immunity, to have less poverty, to increase equity, economic growth. Very happy to work in this field as my colleagues, because this is, I think, is one of the most ethical, most exciting, and most impactful. And in fact, the value-based approach fits perfectly with the agenda promoted in September 2019 by the European Commission, together with the World Health Organization, that published the document 10 Actions Towards Vaccination for All, defining a real decalogue to guarantee vaccination for the entire population and to prevent and, where possible, to eliminate vaccine preventable diseases. We can do that. We are working, and with the colleagues today, we are just explaining that infectious disease and related cancer do not recognize geographical and or political boundaries, and they require a global value-based approach for their prevention control. And in this global approach of values, the values of universal coverage, the values of life, the values that we have described are going to play a crucial role. Thank you very much for your attention.
Thank you very much, Professor Ricciardi, for this very complete overview of the values we need to put in practice to really prevent a disease and increase the health and well-being of our population. It's my pleasure now to introduce our next speaker, Professor Chiara De Vaure. Chiara is Associate Professor in Public Health at the University of Perugia, and her current research is mainly in the field of epidemiology, vaccine preventable disease, vaccination policies and strategies, health technology assessment, and public health. Chiara, the floor is yours.
Thank you, and good morning from Italy to everyone. It's an honor and a pleasure to present the value-based vaccination results. And I would like to thank all the colleagues who work on the project, Dr. Calabro overall, and the steering committee that today is participating to this event. I would like to start from the Immunization Agenda 2030, which calls for a world where everyone, everywhere is provided with the full benefits from vaccines. There are several actions that call from the Immunization Agenda, and among them we find commitment and demand. The objective of this action is to ensure that all people and community value immunization services. So there are several strategies that should be pursued. Among them, the increase in knowledge and awareness of the value of immunization. And this project is aimed to do it. Well, the project had three aims. The first one was to define the value of vaccination based on the 4 pillars proposed by the expert panel on effective ways of investing in health. Then to collate together the evidence on the value of vaccination and eventually issuing recommendations to drive broader dialogue and meaningful policy actions for a value-based decisions in vaccinations. So for the first point, we try to disentangle the value of vaccination according to the personal value, which refers to individuals' goals, allocative value, which refers to the equitable distribution of resources, technical value, which refers to efficiency, and society value, which refers to social cohesion, solidarity, connectedness. For the second point, we perform instead a systematic review on 3 databases. Here you can see a picture of the findings of the review. We found 54 papers that address the full value of vaccination as main objective. But indeed, just the majority of them, more than 80%, just addressed 1 pillar only of the value of vaccination. The majority of studies, 36, as you can see from the picture, address the technical value, so efficiency. The second most common dimension that was addressed was personal value from 15 studies. Then society value with 9 studies and 6 studies addressing instead allocative value. So the first remarks that we can draw is that few studies address the full value of vaccinations. Indeed, the majority focused on an old dimension, which is efficiency, and very few studies address the most challenging pillars, which are societal and allocative values. Here you can see an overview of dimensions that were considered within personal and technical value. In particular, I would like to underline that with respect to personal value, the majority of papers address patient-reported experience measures, while for technical value, the majority of studies address cost effectiveness. Nevertheless, I would like also to point out that 4 studies in the technical value address the broader economic impact of vaccinations. Indeed, we have to say that in the current evaluation frameworks that are used in vaccination, there are several core values, and among them we find cost effectiveness as well as other epidemiological and health dimensions. But there is a growing attention to patient-reported experience measures, and we need to strengthen approaches to value individuals' lifelong benefits and indirect benefits and costs. Here you can see an overview of dimensions that were considered within allocative and society value. There is an heterogeneous situation in respect to allocative value, but we can conclude that the most common dimensions that were addressed were affordability and innovations in delivering of vaccinations. While for the society value, there is an equal number of papers that address population's well-being and indirect protection. As for population well-being, we should say that it was assessed in different ways because several papers look at outcome-related productivity, but other ones look at social cohesion, which is really important because it's the ability of people to contribute to the community. While for allocative value, we have to stress that such dimensions such as equity, accessibility were not addressed so far. So on the basis of the findings of the systematic review, we identified 3 challenging areas. The first one was research, the second one, public engagement, and the third one, decision making. With respect to research, it's clear that we need more data, more evidence on the broad impact of vaccination, and this should consider also the impact of vaccination on antimicrobial resistance, long-term productivity gains, community externalities, and equity, accessibility, and macroeconomic implications. While for public engagement, there is the need to strengthen community awareness and acceptance of vaccination. And I would like to underline that these two pillars, awareness and acceptance, are really important to in the fight against low vaccine uptake. While for the decision-making process, we need to foster the evidence-based decision-making through the development of expertise and establishment reinforcement of technical advisory groups' role, but also the adoption of new methods for the appraisal. Indeed, we issued some final recommendations according to these three areas. So we will start from research. Here you can see the recommendations. The first one is to develop, first of all, a consensus on the value of vaccination. Then we need to analyze barriers to the assessment of this full value of vaccination and expand and translate research, strengthening evidence and data generation, which is important not only to develop policies, but also to monitor policies once implemented. Then we need to implement and develop models and tools that can be used in the current evaluation framework, such as a technology assessment, and eventually develop a positive and collaborative public-private partnership in order to have the development of innovation also in vaccines. Then for the public engagement, we need to identify levers to enhance individuals and community knowledge of the full value of vaccination, achieve better literacy on the value of vaccination, and develop and test strategies to actively engage community at large in vaccination. And eventually, for the decision-making process, we need to develop capacity building initiatives for both researchers and decision makers, launch initiatives to really incorporate the 4 pillars of value in the decision-making process, improve the governance of the decision-making process through collaboration among stakeholders, and encourage shared decision-making process among the relevant stakeholders. I thank you very much.
Thank you very much, Professor De Vouwer. It's now my pleasure to introduce the next speaker, Dr. Siddhartha Datta from WHO. He is the Regional Advisor for Vaccine Preventable Disease and Immunization Program in WHO Europe. And he's leading a team that support WHO member states with a routine immunization and now with a special focus on COVID-19 vaccine and vaccination. Dr. Datta, the floor is yours.
Thank you, Marta, for those kind words, and very warm and a good morning and a good afternoon from the regional office for Europe in Copenhagen. First of all, I think I'd really like to thank the World Federation of Public Health Associations to invite us and share some of the views, and we'll be very much glad to do it based on what Professor Walter and Professor Kira has just outlined, the different elements of this important topic. So let me take a couple of steps back and start outlining what the values in healthcare that we all have been talking about. I think there are 2 important principles in the value of healthcare, as we say, health being essential to the development agenda in a country, and we feel that it is and should become a development agenda in every community. Any healthcare decision or health decision being made by an individual or by people's representative or by a system should foster towards a sustainable and a resilient healthcare system. So when we talk about values, we have seen Professor Kira mentioning about the Immunization Agenda 2030. I also want to bring here to see whether the values framework that we are all talking about, did that happen in reality? And if you look into a very recent example of the Strategic Advisory Group of Experts on Immunization at the global level towards the allocation of the COVID-19 vaccines to the world and between countries, they have outlined a very concrete values framework which have been used by the member states to align its prioritization of population groups towards the vaccine availability in the setting that the supply was limited. So when we talk about values today, I think we have already seen a concrete implementation of that values in the allocation of the COVID-19 vaccines across the globe. We need to do more. And I think that framework allowed an intention of everybody coming together to make that allocation and the prioritization decisions on COVID-19. The values framework of the COVID-19 is just a start. And I think the study result that we have seen from Professor Kira outlined that those are different elements. It's not one element that we should be embarking on. There are issues around evidence-informed decision-making, for which values is an integral part, but also the value in healthcare, under the primary healthcare and the universal health coverage, where immunization is an integral part of it, provides us that bigger platform. Now, as a part of these values, we sincerely feel there are three important elements. One is the human value or human well-being, which in this project is talked about the personal value. It's an appropriateness of the care for the person's own personal goal, which is important. Immunization is an individual responsibility, but also as we move beyond an individual goal is around what we say an equal respect. The responsibility around the society or the societal responsibility of immunization is also a big element. What we say in this project is of the societal value. I think the contribution of immunization to the healthcare, to the social participation, or the connectedness. And I think the other important part here brings the issue of equity and solidarity. And I think the greatest example that we have seen in the recent times is if we look back into the last few months and the COVID-19 vaccine deployment and vaccination, this has equally shown how the concept of me, myself, does not stand strong in the sense that we have to talk about us in this whole, where the solidarity across the border, beyond borders, comes into play. Professor Walter highlighted that infectious diseases know no borders. And I think we have all seen that how we need to make sure that everybody is protected around us so that we can remain protected. That is where the equitable distribution of the available resources come into place within this value of allocation. And equitable allocation will just make the things much more better moving into the immunization program. Obviously, whatever decision we make, whether it's a personal value or a societal value, or for the allocative value, the technical impetus in each of these is extremely important. Whatever decision is being made by a public representative or a people's representative or by the technical policy planners need to be based on robust evidence. Science should be leading this discussion, and science should ensure that the value of equity, value of solidarity in the immunization program is critical. We have seen these four pillars, as we say: personal values, the value of society, allocative value, and technical value. Let me try to then bring all these things together to ensure that where are those integrated points wherein everybody can come together. I feel that a governance around the vaccine-related decision-making process is where everybody can find its own place. The both individual decision-making process and the decision-making process for the society, we need not only one or the other. It has to be one and other. It's not an issue of only health authorities making a decision. It is a decision wherein the health authorities, along with health professionals who are the technical leads, but also the researchers and the citizen ultimately will come around. However, when we talk about resources, we just cannot leave the private enterprise outside the entire horizon. So this is the overarching governance model in any decision-making process need to find its place. Obviously, as a part of this entirety, we're talking about healthier population, healthier societies, the health value and the non-health value of immunization, and contributing to the fundamental sustainable development goal of this of the entire world. In this process, the engagement of the community, engagement of the individuals within a community is extremely important element moving forward. The research for understanding the perception of the community, why do they come forward to get the vaccination, or why they do not come forward for the vaccination, will play an immense role in understanding the individual perception and tailoring the program of vaccination in each of the communities so that the benefits of these vaccines can reach them. This public health intervention, as we say, or public health, as we say, is made for the public and by the public. So these whole values that we talked about should not remain within the realm of the books. It has to be now translated into some demonstrable action and demonstrable intervention. As we get into this, the interlinkages within these values, understanding the barriers in each of these components will just allow us to benefit from the full value of vaccines and vaccination beyond the health benefits. And I think the non-health benefits of vaccines and vaccination, I think it's a high time that we make those much more concrete, much more robust, so that people can see the entire value of vaccination. It's extremely important that we have that urge to do more research into understanding the broader societal impact so that a person, a parent, a policymaker can see that the dollar invested in the vaccination program really brings big value. We have to also understand that not all one size fits all will be useful in ensuring that these values or the impact of these values they get an impact out of understanding and implementation of the values. This needs a tailored approach in every country or every community so that all of these values can fit its own place, but with the local context. And as we engage with the communities in this whole process, this will just bring more objectivity in implication of this whole process. And the last one I want to also highlight here, that as we talk about innovations in this vaccine ecosystem, I think COVID-19 vaccine deployment is showing how countries are willing and are taking steps to make high value innovations. I think it's extremely important that we keep this process going. And these innovations will just bring all these 4 different elements together, but with a more community engagement in this process. When we talk about community engagement, the public-private partnership is extremely important element so that the system that we are building upon now, the vaccination ecosystem that in every community that we are building, will have more sustainable and towards a resilient immunization program of tomorrow. So I hope I could provide you some element around that topic. Thank you so much, Martha. Over to you.
Thank you very much, Siddhartha. And it's now my pleasure to introduce our last speaker for this first part before moving to the panel discussion, Professor David Bloom, that is joining us through a video. Professor Bloom is Professor of Economics and Demography in the Department of Global Health and Population at the Harvard Deacon School of Public Health. He is an economist whose work focuses on health, demography, education, and labor.
Thank you, Dr. Riccardi, and good day, everyone. At the outset, I want to express my appreciation to the World Federation of Public Health Associations for inviting me to help serve as a fire starter for this webinar. I also want to say that I admire the commitment of all the webinar registrants who've come to hear about the myriad and sizable virtues of vaccines and vaccinations. I've been asked to be brief, so I'll limit myself to discussing 2 key points. The first point is that one of the great and still emerging lessons of economic history is that healthier means wealthier. This is the idea that health is a form of human capital, akin to education, which increases the productive capacity of people and their corresponding economic contributions. For purposes of this webinar, the finding that healthier means wealthier is extremely important, and for 2 main reasons. First, it's important because it takes an old view of health spending as a weighty albatross around our budgetary and fiscal necks and transforms it into a new view of health spending as productive investment. The second reason the healthier means wealthier finding is important has to do with the fact that health trajectories are not predetermined and fixed. They can be influenced through behaviors, through the level of resources we devote to health, and through the way we use those resources. I'm speaking, for example, of adaptations like improving our diets, engaging in more physical activity, reducing consumption of tobacco, operating clinics and hospitals that are better staffed and stocked, and undertaking medical R&D that encourages breakthroughs in the detection and treatment of different health conditions. Naturally, I'm also speaking of the development, delivery, and administration of vaccines, which are widely heralded as one of the greatest inventions of all time. However, when it comes to vaccines and vaccinations, there's a major irony. The irony has to do with the fact that disease prevention through vaccination has been and continues to be routinely undervalued. Vaccination has been undervalued because academics, policymakers, and health technology assessors have traditionally been preoccupied with just 2 sources of benefit when it comes to vaccination. The first source of benefit is the number of cases averted, whether that be cases of infection, hospitalization, or death. And the second source of benefit is the reduction of health spending due to reduced numbers of cases. Policymakers have, however, generally failed to recognize and take proper account of the multiplicity of economic benefits that follow from the health gains that vaccination confers. In other words, although policymakers usually get the point that vaccination promotes health, they typically neglect the related point that health promotes economic well-being. What I'm saying here is that vaccination creates societal value not only by improving health, but also as a result of improvements in non-health aspects of well-being that follow from vaccine-driven gains in health. The second half of this causal pathway, in other words, the portion that runs from health to societal value, that portion has tended, as I've alluded, to be a blind spot for policymakers. And it's been a consequential blind spot at that, insofar as it's led to underinvestment in both vaccine development and vaccination coverage, very much to the peril of populations throughout the world. The blind spot here causes us to miss out on numerous health, economic, and social benefits that vaccination delivers. As examples, the blind spot hides a whole slew of childhood, adolescent, and young adult educational benefits that take the form of better school attendance, greater educational attainment, and gains in cognitive function. The blind spot also hides benefits associated with elevated levels of labor force participation, hours worked, productivity, and adult earnings, including the additional income people generate when they're healthy enough to work and don't have to care for ailing family members. And the blind spot also hides improvements in social equity that typically result from the fact that the benefits of vaccines and vaccinations often accrue disproportionately to poor people who live under crowded conditions, and also accrue to disadvantaged racial and ethnic minorities and vulnerable groups like women and children who may lack access to healthcare and healthcare of quality. Vaccination programs typically involve public cost. What needs greater appreciation is the fact that public costs are most naturally and appropriately compared to public benefits, that is, to full public benefits and not just a fraction of them. The world has, for decades, been using a defective yardstick to guide decisions about vaccination programs, and this has generally led to an inefficient allocation of social resources, which is just a piece of economic jargon that loosely translates as suboptimal or just plain bad decisions. With few exceptions, studies that target the full societal value of vaccination point to rates of return that vary from attractive to absolutely eye-popping. I'm speaking here of rates of return that easily surpass standard hurdle rates for all sorts of attractive investments, and that even outrank the return on investment in basic education for girls. And that particular comparison is especially notable because girls' education occupies such an exalted place in our minds and treatises as an instrument of economic growth and development. I can also tell you that in addition to being sizable, taking proper account of full societal benefits is sometimes decisive with respect to whether the intervention falls below or above the relevant HTA threshold for vaccination, recommendation, and reimbursement. Now, nothing I've said should be too surprising to any of us. After the experience of the past 16 months, the observations that diseases have wide-ranging impacts on society and that vaccination offers benefits that extend beyond just improving people's health and reducing medical bills should be familiar to us all. More specifically, the fact that this conference is being held via Zoom rather than in person and face-to-face is a powerful testament to the wide-ranging impacts of diseases and the value of their prevention. Our lives have been ruled for the past year plus by the threat and the devastating impact of COVID-19. This has been an epic catastrophe with major effects ranging from school and workplace closings to high levels of excess mortality with considerable heterogeneity and impacts across sectors, geographies, and demographic groups. My contention here is that COVID-19 provides self-evident proof of, first, the negative effects of health risks on income and schooling. Second, the fear of visiting medical providers. Third, the anxiety surrounding health risks. Fourth, the importance of infection dynamics, herd effects, comorbidities, and outbreak control. And fifth, the social and economic inequities in risks of infection and access to quality healthcare. The world understands, it's come to understand the full societal value of COVID-19 vaccines, and even more so in the face of the highly transmissible and more lethal variants of COVID-19 that are now circulating. If it hasn't already, the pandemic should dispel any remaining doubts about the sizable magnitude and the wide range of health, economic, and social contributions conferred on people and communities by COVID vaccines in particular, and by vaccines more generally. I'll close on that point and sign off by thanking you all for your engagement and wishing you a fruitful webinar. Bloom over.
Thank you very much. We now move to our next part of the webinar, the panel discussion that has been organized around three main themes. The first one is about the recommendation on research that we will discuss with Professor Jörg Zollner, a full professor of health economics at Aalborg University of Applied Science, and with Professor Amerigo Cicchetti, full professor of organization theory at the Catholic University of the Sacred Heart and director of the Advanced School of Health Economics and Management. I invite also all the other panelists to jump in case they wanted to discuss or to add their point of view to the specific question. So my first question is for Professor Cicchetti. What are, according to your experience, the new methods for evaluation of the broad economic value of vaccination? We can think about.
Thank you very much for this invitation and also for this question. Yes, we actually I worked at trying to understand how to capture the full economic value of vaccination. And actually, we have applied these ideas in during a European project, Impact HTA, devoted to implement new methodologies to understand the economic implications of the introduction of new technologies. And we have focused on the concept of fiscal impact. The fiscal impact of a technological innovation should be measured taking into account the accumulation of human capital and the increase of population health, because these are key drivers for economic growth. And when you have a technology that is able to have an impact on these dimensions, of course, these kind of technologies should be under the attention of governments that should invest in this kind of technologies. If we take a broader perspective that is not only the one of the Ministry of Health, but actually is the perspective of the whole government of a country. And for this reason, we have developed this model that has been firstly applied to 3 vaccinations in Italy. And what we have found is that when you invest €1 in vaccination, you can produce up to €18 in terms of reduction of social security costs, and in terms of increase of tax revenues generated by the increase in the income of the population. In general, what we are using in terms of economic modeling measure the economic impact of a vaccine or any other technology, we use budget impact models. Budget impact models are going to compare the cost for the healthcare system of the traditional approach with the new approach. So, for example, reaching a specific coverage with a vaccination or a different and higher coverage of a vaccination. But actually applying a different perspective and applying this methodology that again has been tested, we can really have a more clearer understanding of what is the real economic impact. Of course, this approach has some limitations that should be faced, and more research is needed because, of course, the indirect fiscal impact estimation in terms of employees and consumption is difficult to be done. In fact, individuals not always understand clearly the questions that are posed during these interviews that are used to, collect this kind of data. Sometimes, and we have experienced some missing values or inconsistent responses, but nevertheless, we have found that it's possible to apply the right way to collect this data on the income, the economic impact in terms of income and tax revenues, to produce robust data in terms of whole economic impact of vaccination or other technologies. We think that this is the way really to have an allocation of resources that for healthcare intervention that take into consideration these resources as an investment and not as an expenditure, because they're generating value for individuals, the community, and the economic system. And the fiscal impact modeling is structured to capture all these economic implications at these 3 levels.
Thank you very much. Professor Zollner, for you, what are the ways to tackle intellectual property rights and to boost the public trust in science?
Thank you very much, Marta, for your question. And I'd like to make this really interactive discussion, as you said. And the question you just asked lends itself very nicely to one question sent in by one of our audience. how to secure prioritization of investments in vaccination in the frame of countries' recovery plans. Well, indeed, I see two somewhat, well, not sure, competing or complementary models here. One is our classical models of intellectual property protection, patent rights, market exclusivity, and very attractive prices for manufacturers. And the other one is based on public funding, public-private partnerships. And for starters, I don't want to rule out either one. I don't want to say one is better than the other. As a matter of fact, I'm a bit wary of calls being made as we speak. I think very blunt, somewhat premature calls of saying we lift all intellectual property rights. I'm not sure this is the recipe for success, because it would take away any incentive for speedy development of new vaccines that we have seen today. I have to say, tremendous success in the both in the past and in the current COVID-19 development. Having said that, we've had the privilege of the price leak of one Belgian member of the Commission. We know that AstraZeneca was mainly based on a funding model leaning towards a PPP, whereas the other one, Pfizer-BioNTech, is more the classical IP protection and high price model. I think the current epidemic lends itself very well to a research laboratory also into these issues. What is the best funding model? What is the best incentivation model for research? So for the time being, and to your question, I would see them as complementary and let them run in parallel. We do need to keep an eye on prices to be affordable, despite all of the incentives that we want to create. Having said that, I think it also lends itself, with all the basic research implied, it lends itself very nicely as a model for public-private partnerships. Apart from a funding discussion, this would also spill over into probably confidence in vaccination, which is sort of a lead over to the second part of your question, Marta, namely the fact that in order to overcome vaccine hesitancy, and let me be more blunt, let's even call it conspiracy theories surrounding all the issue of vaccination. There's a large mistrust in a small group of the population, but still it's sizable. I think we also need research into this issue. Where does this mistrust, where does this conspiracy theory come from? Is it triggered through ambitious pricing? Is it triggered through misunderstandings of the past, of withdrawn research on autism caused by vaccines and the such like? Is it just is it worry about safety, side effects, the speedy development that we have seen these days? So there's a lot of research, social science research really, and not just lab research to be done that we need to undertake in order to overcome that hurdle as well. So I hope I have covered your question, one of the audience question. There was another one saying for value it can be important, but is it ethical to ask people who cannot expect an advantage, namely the youth, to get vaccinated? This is a very interesting and relevant one. I don't want to claim the ownership to the answer to that question. It is clearly a test to, I mean, this whole vaccination business is a test to the solidarity across generations and across countries. That is clear. It's probably the acid test that we have never seen to that extent, solidarity. So that is, it's a social science research hypothesis. in its own right. I'm afraid I don't have the final answer to the audience question here, but it's clearly a question into our own values. So how much do we feel the need to protect our next of kin, our neighbor elsewhere against this outbreak? And I invite any of my co-panelists to hop in to, to express their view.
Thank you very much. I would like to move to the next part of the panel. We may come back later to this part about the decision-making process. So we have the pleasure to have two members of the European Parliament, Dr. Pizlau and Dr. Buzoi, as well as Dr. Retzel, General Director of the Preventative Health in the Ministry of Health, as well as Professor Siciliani, Professor of Health Economics at the Department of Economics and Related Studies at the University of York. My first question is for Dr. Pizlau. What are the ways you can suggest to encourage shared decision-making process of vaccination among relevant stakeholders?
Yeah, thank you very much, Marta. Indeed, I would like to begin by thanking the World Federation of Public Health Associations for inviting me. It's really an honor to be here and to be able to share with you my thoughts on the role of vaccination, especially on the economic impact, and right now, to answer your question, the decision making. I am a doctor, but in economics. I have my PhD on that, but I really appreciate the way in which, especially, greeting all my colleagues here. Indeed, I just wanted to underline the fact that from an economic viewpoint, it's really important to focus on, this kind of societal impact, health impact. And I think that the topic that you are putting here forward is really important. I think that the pandemics has actually highlighted the importance of vaccination, and it's really important to just not go back after we hopefully finish the pandemic period to go back to the practices that we had before. So again, congratulations for choosing the topic. Now, in terms of decision making. One of the things that we've seen during the pandemic more prominent than in other periods of time is that whenever we are in a crisis or extremely vulnerable situations, people tend to become skeptic and pay less attention to the source of information, which leads them to fake news and thus generating fear. And I really believe that for proper recovery and consolidated resilience of the Union as such, is to be sure that we have more data, more explanations, better communications, generally speaking. For us as decision makers, it's really crucial to be able to provide this kind of evidence. So it's actually a twofold process. On one hand, is to inform the population with the scientific evidence and to be sure that the positive impact of vaccination is taking into account. And the other thing, which is really important, is that we as politicians and decision makers are going to work data-driven, evidence-based, providing evidence-based policies. And so that's actually, I would say, really, really important. And indeed, we've seen that right now during the pandemics, we have some strange effects. On one hand, we see a proportion of a population more or less disbanding not only the vaccinations related to COVID, but disbanding vaccinations altogether. So we are more or less halting processes that were going quite well. We were halting or postponing processes, partly because vaccination staff was reallocated, partly because supply chains have been disrupted for COVID, partly because school closures determined the interruption of school-based vaccination program. So we are right now in a situation in which the whole world of vaccinations was more or less torn apart. What is important right now is that we use this opportunity and not only revert, as I was saying, to what was happening before, but more or less advance to a different model where vaccination obviously has the main purpose as saving lives or improving lives. But the second part of that argumentation should be related to the cost effectiveness of prevention. And I am coordinating of the Employment and Social Affairs Committee in the European Parliament, and I can tell you that what we are actually pushing is the concept of social impact investment, that is focusing on prevention, focusing on how we can improve lives and help people and citizens by focusing on prevention at early stages. And we are not talking only about health, we are talking about education as well, and many other social interventions that we have. And I would like to finish my my intervention here by highlighting a couple of things that are coming from the European Union and from the European Parliament that will actually be helping decision makers in member states improve the vaccination programs and focus on early prevention. I was mentioning the social impact investment, and the Commission will come in at the end of this year with the social economy action plan that will have that component as well. But we are also talking about the child guarantee, and we have a council recommendation on that, where children's access to health as early as possible, including vaccination, is actually quintessential. We are talking about EU for Health and the entire focus at the European Union on health measures. We have been talking recently last week in the Parliament about the HPV vaccine. So the agenda is right now with a lot of opportunities for pushing the importance of vaccines and the cost effectiveness on that. And again, if you just look on studies, I was actually amazed when doing my homework for this particular session, that for childhood vaccination that is going to be part of the child guarantee package, the return is up to $44 for each dollar invested. I mean, I was amazed by this kind of returns. And the same thing goes if we look at Europe experience. For instance, Italy, after 20 years of universal hepatitis B vaccination, basically that led to 790 million euros in net societal savings. Netherlands as well, for each euro invested in adult vaccination, starting at age 50, is actually yielding more than a multiple of more than 4 for future economic revenue. So decision making, be sure that we communicate well to the population, be sure that we are data driven and evidence-based driven, and right now use the momentum that we have of health as being on top of the agenda of the EU at the national level to transform structurally the way in which we see social expenditure and transform it to social investment, and especially when we talk about health investment. So that would be my angle for this particular intervention.
Thank you very much, Dr. Pislao, very interesting. I would like now to ask to Dr. Rezza his opinion about the development of capacity building initiative for both the researcher and decision makers. Do you think this can be a solution to improve the quality and relevance of research on the topic and its application to the decision-making process?
Thanks for the question, and also thanks for the kind invitation to this important meeting. Actually, I was wondering about what we need to make evidence-based decisions, because I think that is very important in the field of vaccines and vaccination. And of course, first of all, we do need, as shown also by Chiara in one of the first presentations today, we do need the research and good research to produce proper data on vaccine value. For sure, we do need data and appropriate and accurate data on the impact of vaccine and vaccination on the individual and on the community. In terms of prevented cases, especially prevented severe cases and deaths. We see in these days actually that it's with the COVID crisis, how much is important to produce data that then are valuable for evaluating the impact of vaccination on the individuals and on the society. The other point is we need to evaluate very carefully and appropriately vaccine efficacy and effectiveness. Sometimes we see a sort of let's say, evidence-based data fallacy due to a limited number of clinical trials that are conducted on specific topics. For example, when we use very specific endpoints, then we cannot appreciate the efficacy and the effectiveness of vaccines in an appropriate way. For example, with regard to COVID vaccines, many studies have as an endpoint any symptom, and they usually underestimate the efficacy and the effectiveness of the vaccines, because if we consider, for example, other endpoints such as severe disease or death, we see that actually the efficacy is much higher than that reported in some of the clinical trials that have been conducted. Another important point is to evaluate cost effectiveness, taking into account the full value of vaccines. And I think that the presentation of David Bloom actually to this regard has been really very, very important. Then when we have those data, actually, it is important to spread knowledge about the impact and efficacy, effectiveness of vaccines. And we do not need a communication crisis such as that we have seen, for example, in these days during the COVID pandemic. And we need to spread all this knowledge to all the stakeholders, not only to those who are experts in the field, not only to public health authorities, but also to the public. Then we have to use this data to make decisions. That is not simple. I've been a researcher during my life. Up to 1 year ago now, I'm in different position. I'm sort of decision maker, but see how it's difficult to make decisions on the basis of the data, on evidence-based data, because actually we have to interact with many different actors and also with politics, and sometimes it is not easy at all. And an important thing is to keep transparent relationship with the industry, with the private sector, because public-private collaboration is actually very important, especially when you need to invest in some vaccines that are not fruitful in terms of return of money. Then, last but not least, it's important to have a global perspective. We see these days that actually there are, during the COVID pandemic, there are a lot of emerging virus variants that have been identified in several countries around the world. And we need to concentrate the attention on what is happening outside Europe, outside the United States, because we know that what is happening around in poor resource country then may produce also problems to us. So it's a sort of interest altruism that we need in order to use well vaccines, to make vaccines available everywhere, to facilitate access to vaccine in poor resource country, because it's also our interest. Thanks.
Thank you very much. My next question is for Dr. Bouzoy, the other member of the European Parliament joining us today. what are for you the ways to improve the governance of vaccine-related decision-making process by building a vetting and open collaboration between health authorities, health professionals, scientists, citizens, and the industry?
Thank you so much for inviting me to this very interesting discussion. And I try to bring a perspective from the two main responsibilities that I have in European Parliament. One perspective, of course, will be from Industry, Research and Energy Committee that I'm chairing in European Parliament. And research is extremely important. And also it's extremely important also related to vaccines. And you know that the public trust is very much linked with a good quality of vaccine. So here, good research is essential. And of course, the other perspective is from the EU for Health rapporteur perspective. And there, you know that in EU for Health program, we included the idea of promoting vaccination and reducing vaccine hesitancy, which should remain an important target of our policies, even beyond COVID-19 crisis and COVID-19 vaccines. Non-vaccination and the deepening of vaccine hesitancy will, of course, make worse the current crisis, and in the future could put important problems to our public health. 45.5% of the Europeans thought that vaccines are not safe. And this approach will hinder the immunization campaign expected for this summer and, of course, during the autumn. The Parliament very clearly supported the idea of vaccination. The European Parliament, in its resolution, noted that vaccination already before COVID-19 prevented an estimated 2.5 million deaths each year worldwide and reduces disease-specific treatment costs, including antimicrobial treatments. It's very clear for us, those which are involved in the public health area, that immunization through vaccination is the main tool for primary prevention of disease and one of the most cost-effective public health measures available in the world. And we have two situations then that require thinking at immunization. The existing vaccination situation before the current pandemic and the vaccination due to pandemic. And to answer to your question, from my perspective, solutions such as implementation of compulsory vaccinations along with penalties such as substantial fines or refused access to state schools, for instance, is not feasible. We had this discussion in many member states. We had it also in my country, Romania. This is not feasible, and it is not a long-term solution to increase immunization rates. These measures could even generate a stronger hesitancy to vaccination were implemented. In my opinion, feasible solutions that we policymakers need to be discussing would instead be improving communication strategies. And here it's true, we need a strong partnership and strong collaboration between policymakers, not only from the health area, but also at the highest level, like prime ministers, other kind of ministers, and also other public figures that are very trustable for the people. Academia, professors, medical doctors, researchers, and of course industry. It's important to have a good cooperation and good partnership with the industry in order to promote the most important information relating to strategies, to vaccination. So improve communication strategies, boosting information campaigns across the EU in order to promote accurate, science-based arguments and enhance member state citizens' knowledge and understanding about the importance of immunization against severe and sometimes fatal contagious diseases, because you have to look to the vaccine hesitancy even beyond COVID-19 situation. The key factor EU bodies and all the other stakeholders involved need to focus on is the understanding of the behavior drivers of vaccine acceptance. As this factor needs to be maximized, the chance of negative health effects resulting from vaccination needs to be urgently minimized as close to zero as possible. We had even yesterday a discussion between the COVID-19 working group in European Parliament. We have the three committees involved, ENVI, ITRE, and INTA, the three chairs and the political coordinators of the political group, the coordinators of the political groups, with the European Commission, Vice President Shinas, Commissioner Kyriakides, Commissioner Gabriel. And of course, we are all very worried. We worry that at this moment, the vaccination campaign is a little bit under big question mark in many member states. And the pandemic is not over. You see the situation with the Delta variant of the virus. Of course, in those countries where the vaccination rate is still low, even the classic virus could put a lot of problems. So we need to boost vaccination now during the summer and during the autumn. And here European Commission is very strongly committed, and the support of European Parliament is there very strong in order to find all the necessary solutions to increase the confidence in vaccination and to boost vaccination. And of course, this will have effects on the long terms, because if people will understand now the benefits of vaccines in general, of course, not only of vaccines against COVID-19, then on the long term, even vaccines against other important diseases will be better accepted by the people. I believe that we need to ensure transparency on information on clinical trials. And here, of course, EMA is very much committed. We are now reviewing the legislation in order to strengthen European Medicine Agency, to give them more tools, especially in time of crisis, but not only. And of course, in the context of pharma strategy, this will be also necessary to have the good tools and the good prerogatives in order to also help promoting vaccination. But it's clear that we need more transparency on information on clinical trials. We need concrete national immunization strategies, not only tailored for this pandemic, but also tailored for times of crisis. And of course, we need a joint efforts together, both the decision makers and the industry. Thank you so much.
Thank you very much. I would like to wrap up the second part of the decision-making process with Professor Siciliani and discuss with you what are the leverages, the real practice that we can have to incorporate the value-based approach in the practice of policy development and implementation.
Yes, thanks a lot for having me here. So I really spent most of my thinking time in relation to this recommendation, how to incorporate the four pillars of values in decision making. And my conclusion is that actually these four pillars that have been identified through the expert panel, I think they can be included relatively easily with existing methods. So if we go quickly through the four values, I mean, technical values basically means efficiency. So as your review and your projects highlights, this is the most common one that you observe in the literature. And this is basically cost effectiveness, cost utility. So this is our standard tool. Now, the next one, which is allocative value, is the one that you find that is, you found it much less in the literature. And that really relates to equity. I mean, that at some level is a bit of a paradox in the sense that, we always say that we want to reduce inequalities, but then this concept gets lost in the practicalities. In that sense, but we have like toolkits to deal with equity. So you can look at subgroup analysis. You could look at those individuals with a higher risk or higher ability to benefit. But there are quite a few options. The other option is to look at socioeconomic inequalities. And in the context of vaccination, this can be a little bit difficult because we know that the effect of education, for example, on hesitancy is like a U-shaped. So it's actually both the low education and the high education that tend to be the most hesitant. You can see that. So I would like in the future to see more equity element integrated with the cost effectiveness analysis or cost utility analysis. And the tools are developing. There are a few different options out there, but then, then doesn't reach policy to the extent to which it could. I would also like to emphasize that when it comes to policy interventions, it's pretty clear that vaccines are cost effective. When it comes to specific policy interventions in terms of communication strategies or reaching out some, the hard to reach groups, these potentially are a bit more costly interventions. So that's where, again, maybe some of the cost effective analysis could be useful in terms of comparing the effectiveness of these different interventions. So I think that's quite important in that context. Now, if you move to societal value, I think that's also potentially can be included. I mean, you mentioned herd immunity, which, that's where epidemiology meets with cost effectiveness analysis. So that's already there. To me, it's more difficult to think how you include within this framework social responsibility and cohesions or patients' empowerment, in the sense that probably you need social cohesion to increase vaccination rates. It's a bit to think the other way around. So in that sense, how do you include social cohesion in a framework in a quantitative or qualitative way? It's less clear to me. So in that sense, I think that's what drives probably the actions to we want to promote societal value, but to include it as a pillar in a framework is a little bit more difficult. And then finally, on the personal values, some of this relates to well-being and the non-health components. And again, we have some toolkit there. Though I guess some elements can be a little bit difficult in the context of vaccination, because if some individuals who are more hesitant and have a lower perceived value, how do you include that? So this doesn't come free or necessarily is not very easy to include. So just to sum up on that, so I think it's very valuable to have these different values. And so to move from value to values, but then actually there is a point where you have to bring it back to one overall value concept. Otherwise, from decision-making process point of view, then it becomes quite difficult to manage. So in one piece that I've followed up with the European Observatory colleagues, what we have suggested there is to try to bring this all back from with a well-being perspective, because the well-being perspective potentially allows you to take into account both the health and the non-health benefits and also the cost. So I think that could be one way to move forward in terms of bring it to all of this, once we have identified the pillars, still bring it back to one major tool that can guide the decisions. The last couple of points I want to make relate to the other recommendations that you have, that to me, they all relate to governance, in the sense that it's difficult to disagree that you want to improve governance, but what is a bit more difficult is to think what design of the institutions you should have that ensures that the governance works well. So to me, that seems the next step, maybe in the research agenda or policy agenda. Can we agree on how you should design that process so that the researchers and the decision makers come together, which is really the two other recommendations that you have. The first one is capacity building, but capacity buildings, is, again, we want capacity building, but capacity building in itself is not a guarantee of success, because you need that last process and step of shared decision making. So again, that's my last point. Shared decision making, it's great, but I think there is a tension there between how quick you can take decisions and how broad you can make the decision process. So if you make the process very articulated and comprehensive, you may become slow in taking decisions. So really the trick is how do you develop a system that you have a shared decision making, but this doesn't slow down then the decisions to be taken, which in some way links up to parallel discussions about resilience or preparedness at the health system level. So I think maybe you can make that link there. So those are my thoughts. Thanks a lot for having me today.
Thank you very much. We are now reaching almost the end of today's event, and we will discuss now the engagement of the community, which is as important as the one from the policymakers. It's my pleasure to introduce Dr. Antonio Gaudioso, Secretary General of Cittadinanza Attiva. Dr. Gaudioso, how can we define outcome indicators for the assessment of the participation of the community? And would these indicators facilitate the work with the public administration and facilitate the implementation of the best practice to transform ideas into action by the community?
Good morning to everyone, and thank you so much for the kind invitation. And thanks again also for sharing this very, very interesting information and research, and for the debate of this morning. I've learned a lot, and I would like to share some thoughts about following up your question. I think, to be honest, that if you like to work on indicators and the capacity to follow up about the discussion about the involvement of the community, we have to build up a public policy, and we have not yet built up a public policy on the engagement of the community. I think that we have to be honest from this point of view, because I think that sometimes we have to remember the translation of the words, because we are using some words like with the same as the same, and they are not the same. If you think about and discuss about information, empowerment, and engagement, are three different things. Probably same aspects, different aspects of the same problem, but completely different in terms of concrete actions that you have to build up on top. And sometimes when in public policies, in public arena with some interlocutors of public administration, when you think about information, or when you think about engagement and empowerment, seems that it's it's enough to promote information and to share on internet site. This is not the reality. You have to make a plan. You have to involve the associations that they are working on this issue. You have to involve also a process that, for example, investing on the proxy information. If you like to promote the engagement of the community, you have to make an investment on two different sides. For example, one on health literacy, and we are discussing several times about the importance to give to the people the tools to understand how to select, how to choose right information that you need. On the second side, you have to involve the local health systems, in particular the professionals, speaking about, for example, the GPs and the community pharmacists, that daily meeting the people for not only the patients, but in general, the people that are interacting with them daily. To make this, it's not enough, for example, to involve only these people, but you have to invest also to empower themselves. Because if tomorrow morning you meet two different pharmacists, or to meet two different GPs, and to make the same question, probably they give 4 different answers, and it doesn't work in terms of feedback, and is not building up trust, but creating and promoting misleading. So when we think that we have to work in a public policy, I'm speaking about both on one side, which are the infrastructures that we have to invest on, and on the other side, how to work to empower the different actors that can work together to create this kind of empowerment, information, and engagement. Also because involving the community is not only a way to make the processes more effective, but also a way to get information to help the public policies to be more effective. Also because several times when we speak about the vaccine hesitancy, we are thinking about a potential gigantic problem. I would like to remember that vaccine hesitancy is absolutely normal. It's normal that when there is some kind of innovation, you have to explain, you have to translate, because there is two completely different words. Who is hesitant is not a Novax, is a person that is their own right to know more, and is our duty to create an infrastructure to take care about your legitimate need in terms of information, and the feedback in terms of that is coming from the community can help to drive better the campaigns. I'm speaking not only, and also my friend Gianniezza was speaking about the campaign that we are doing on COVID in Italy, and not only, all over the world. But I'm speaking also about the capacity that we can use the information that reversing is coming back by the community, also to create infrastructures that can give us the possibility in the coming years to inform not only about the potential, the gigantic potential that the vaccination campaigns can have in terms of public solidarity between generations, but also, for example, and about the gigantic impact that innovation will have in terms of benefits for health in coming years. Just to mention which will be the impact in the coming years in terms of innovation about monoclonal antibodies, for example, and so on and so forth. So I think that invest on building up an infrastructure of information and engagement and empowerment will help not only about this fundamental work on vaccines, but will be an investment also for the future in terms of health literacy that definitely can help the people to be more free in terms of the capacity to choose the best way to have the access for the health information to take care about their own health.
Thank you very much. We have completed the panel discussion. I let Professor Ricciardi to wrap up the meeting and conclude this very interesting and rich session. Walter, the floor is yours.
Thank you very much, Marta, for your excellent chairwomanship. And I really want to thank the World Federation of Public Health Associations and the whole staff, in particular Maria Del Mata Zacharias, for this excellent organization. Of course, I want to thank all the panelists. I think there was an excellent team of panelists that described and analyzed from their different point of view and gave important contribution. I want to underline that this is going to be published in a report that is going to be produced by Italy. At the moment, you can read the executive summary on the website of the World Federation of Public Health Association, but in the future, you will have a full report. And I really want to thank Vitali, the spin-off of the Università Cattolica del Sacro Cuore, and in particular, the project manager, Dr. Annalisa Calabrò, for the excellent job. I really want to thank the University of Geneva for the support, all the team that has worked to the preparation. And of course, I want to thank MSD for the Untied grant that made this possible. In the future, we will work on value-based vaccination. The world is realizing how important is a single vaccine. You can imagine how in the future, if we understand that many of the diseases, not only the infectious, but also some chronic diseases are related to infections, I think vaccines are going to play an incredible role, and we have to be prepared to propose to politicians and to decision makers the best possible choice according to evidence, but according to values. So the value-based evidence decision making will be the pillar for decision making in the future. And I think that this seminar today has contributed to dissemination and due awareness of this. Thank you very much to all our participants. There were numerous. This has been recorded, and I'm sure that in other parts of the world that at the moment they are sleeping, they will listen to this when they will come. Thank you very much indeed, and take care.